Hello, welcome to Nursing with Professor B. My name is Bridget. I'm a family nurse practitioner. I do videos on nursing, health and wellness, and mental health. If that's something that you're interested in, make sure that you hit the like button, make sure that you subscribe, and make sure you turn on that notification bell. All right, in today's video, I will be discussing cluster C personality disorders. It is the last of the three types of personality disorders. I have done a video on cluster A, cluster B, and finally, I will be doing cluster C. Shout out to Bashir Mustaf for requesting this video. Thank you so much for watching. Personality disorders. Personality is the way that people think, they feel, how they behave, and it affects their experiences and their relationships. And people's personality can change over time. Personality traits evolve continuously across the lifespan, and we have an opportunity to develop and support more adaptive and functioning social relationships. So you can teach a dog new tricks. You can actually change your personality. If there's things or traits that you would like to improve on, you absolutely can. Is it easy? No, but you're able to do it. Personality disorders are among the most challenging and complex group of disorders to treat, and many people with personality disorders have difficulty recognizing their difficulties. And many people with personality disorder don't realize that the difficulties they face often are due to their personality. According to the American Psychiatric Association, there are 10 personality disorders, and these disorders are grouped into cluster A, B, and C. And today I will be talking about cluster C. Risk factors for developing personality disorders are often due to genetics. You don't inherit a personality disorder, but you can inherit personality traits. There can be a neurobiological component, psychological factors from experience, so upbringing, environmental factors, if you experience neglect or trauma, and the diathesis stress model. Many studies suggest that there's a strong correlation between trauma, neglect, and other dysfunctional family or social patterns of interaction on the development of personality disorders among individuals with certain personality traits and temperament. So cluster C personality disorders, they're characterized by anxiety, so anxious or fearful behaviors. There's avoidant personality disorder, which a lot of people are using the word antisocial incorrectly, and they really mean this term, the avoidant personality disorder. And avoidant personality disorder is characterized by feeling socially inadequate, hypersensitivity to rejection, so much so that they don't really go out. That's why people are like, oh, I'm antisocial, but no, you're avoidant if you're not going out at all. Dependent personality disorder is characterized by submissive and clinging behavior, and it's this excessive need to be taken care of. I would say that the example of dependent personality disorder was in Beauty and the Beast, in the movie version where LeFou was Gaston's dependent personality disorder. If you saw in the movie, LeFou lived to worship Gaston. He was submissive, he clung to him, and he basically worshipped him. And then there's obsessive compulsive personality disorder. So when people say I'm OCD, they usually mean OCPD. So people are using all of these terms incorrectly. Having obsessive compulsive personality disorder, it's characterized by being rigid, perfectionistic, and the need to be in control. Whereas OCD, the obsessive compulsive disorder, is the need to wash your hands 5 times before you leave every room, or turning a knob 10 times to make sure it's off. That's OCD versus OCPD. So I love these little drawings as an example of avoidant personality disorder. They avoid activities due to fear of criticism. So the manager says, I want to promote you, but they have a low self-esteem. So they say, I don't think I'm ready for that. And then my outfit is no good. I'll just cancel this job interview today, right? They don't take risks. They don't want to go out. They don't want to leave the house. They don't want to make friends because they're afraid that no one's going to like them. Restraint in intimate relationships. I can't tell him that I love him. He'll laugh at me. A lot of times in avoidant personality disorder, perhaps they had a parent that was very hypercritical. So what they responded by shutting down, by shutting themselves in their room and just avoiding that hypercritical parent so that they didn't have to deal with it. They're preoccupied with being rejected. Hey, you're late. Oh no, he's gonna leave me. And then they view themselves as inferior to others. I will never be as good as those people. And they're reluctant to take risks. Let's play charades. Oh no, I'm going to just embarrass myself. So avoidant personality disorder, they're extremely sensitive to rejection. They feel inadequate. They're socially inhibited. They avoid interpersonal, it says conduct, but we'll say interpersonal interactions due to fears of rejection or criticism. Symptoms in childhood include shyness that increases during adolescence. Their main personality trait is low self-esteem associated with a functioning in social situations, feeling of inferiority, a reluctance to engage in unfamiliar activities involving new people. So what should you do as a nurse or as a healthcare provider? You should be friendly, accepting, and offer a reassuring approach. Remember that being pushed into social situations can give them severe anxiety, so you wouldn't force them to participate in group. Provide the patient with exercises to enhance new social skills, but with caution, and assertiveness training can help the person express needs. What is the treatment? Individual and group therapy is helpful. Psychotherapy focuses on trust and assertiveness training. Anti-anxiety agents can be helpful. Beta blockers such as atenolol can reduce autonomic nervous system hyperactivity. So the autonomic nervous system is what may be activated that makes them feel very anxious, and atenolol can help with this anxiety. And SSRIs may help decrease social anxiety and make them less sensitive to rejection. Now let's talk about dependent personality disorder. They have difficulty in making everyday decisions without excessive reassurance. So I had a guy that I was talking to back in the day, and he would call me or send me a picture every time he was picking out an outfit. Like, come on, like pick your own outfit out. You know, like it's one thing to say what looks better here and there, but if every time you get dressed you have to ask for an opinion, that is symptoms of dependent personality disorder. So should I wear the white or black shoes? Are you sure? Positive? Wait, Chris, come back here. And then you need others to assume responsibility for most major areas of life. Mom, what should I major in college? And this person's 7. 3. Difficulty expressing disagreement due to fear of loss of support. Sure, I'll pick up those drugs for you. I'll see you later though, right? So, for example, even when Gaston's, now at the very end, LeFou finally like broke away from Gaston, but this is where you follow someone blindly, even though this is the term ride or die, right? Like, oh, I want a ride or die chick. Like, no, you don't want to be that ride or die chick. You don't want to be with someone no matter what. There's a meme that's like, I'm not a ride or die chick. I want to know where we're going. What are we doing, right? So you don't want to be in a relationship where people are like, oh, you'll do anything for me, right? You'll be a drug mule for me, right? Or you'll do this. Like, no, do not. That's not the situations you want to find yourself in. And then they feel uncomfortable and helpless when alone. What if something happens? How will I know what to do? And they urgently seek another relationship as a source of support when a close relationship ends. Hi, my ex just died. Will you take care of me now? So it's that inability of them to take care of themselves. They feel helpless. They are unrealistically preoccupied with fears of having to take care of themselves. I can't do this on my own. Dependent personality disorder. They're submissive. Because they don't want that relationship to end, they will take whatever is thrown their way. Like, they will just put their head down and deal with it. They're clinging. They have an overwhelming need to be taken care of. They have an intense fear of separation. It may be the result of chronic physical illness or punishment for independent behavior in childhood. So, for example, if someone is always sick, then, you know, it does make a little bit more sense. Like, who is going to take care of me if I'm so ill that I can't take care of myself? They lack confidence in their own ability or judgment. They're vulnerable to exploitation by others because of their passive and submissive nature, and they experience intense anxiety when left alone for even brief periods of time. So how do you differentiate? Maybe some of you are thinking like, okay, well, borderline personality disorder has a chronic fear of abandonment, right? Let me just give you this test-taking tip. On an exam, it will usually be borderline personality disorder, not dependent personality disorder. That is what you are tested on most frequently. But there is the common feature of BPD and dependent personality disorder is this fear of abandonment, but they each react differently. So borderline personality disorder, how do they react to abandonment? With feelings of emptiness, demands. If you leave me, I'm going to kill myself. Rage, right? Destroying property, destroying a car, burning a house down. They have unstable relationships. They're in a relationship one day, they're out, then they're back together, then it's just chaotic. Whereas dependent personality disorder, perhaps they will be in a long-term relationship because why? Because their partner talks to them in an awful way that no one else would deal with it, but they're so submissive, like, he's right, I was asking for it, I shouldn't have done that, right? And if for any reason the relationship does end, they are quick to jump into another relationship where they can repeat that pattern. So what are guidelines for nursing care? Nurse can help the patient identify and address current stressors. You want to be aware of strong countertransference. It may develop due to the patient's demand for extra time and their crisis states. And the nurse-patient relationship can help the patient increase assertiveness to role modeling and teaching of assertive skills. So help this patient help themselves. Help them make their own decisions. Don't tell them what to do. You're just reinforcing their traits that they currently need to work on. So treatment for dependent personality disorder. Psychotherapy is treatment of choice. Cognitive behavioral therapy. There's really no specific medications. Panic attacks can be helped with imipramine, but keep in mind this is a tricyclic antidepressant and TCAs have a lot of side effects. So may not be first choice, may not be what a psychiatrist would actually order. Yes, we will talk about obsessive compulsive personality disorder. They're preoccupied with details, rules, order, organization. I know I'm late, but I gotta make sure I have everything. My stove is off and my pets are fed and my windows are closed and my doors are locked. They're devoted excessively to work. Come on, we're on vacation. I can't waste time. And they're unable to discard worn out or worthless objects. One day I might need all these tapes. They're reluctant to delegate tasks. Do you need help with shopping? No, you won't do it right. They adopt a miserly spending style. You should treat yourself once in a while. No, I'm saving for a rainy day. They show rigidity and stubbornness. How about some tacos today? But we always have pho on Sundays, always. So I have some family members that are actually like this, and it's very difficult because, especially with my personality, like I have ADD. I'm very laid back. I'm disorganized. So can you imagine someone with OCPD interacting with someone like me? That like it's really hard because of my ADD to like always organize and be clean. I'm very messy. Like everything is always messy for me. So I drive people with OCPD crazy, right? Everything has to be the way they planned it out perfectly. They are the people that like you do have to put the coaster here, the plate here, and like everything is planned. So people with OCPD, they have limited emotional expression, they're stubborn, they have perseverance, which can be a good thing for goals, and they can be indecisive. They're preoccupied with orderliness, perfectionism, and control. It's the most prevalent personality disorder. Risk factors include a background of harsh discipline and having a first-degree relative with this disorder. It's associated with increased relapse rates of depression and increase in suicidal rates. And the main traits are rigidity and inflexible standards of self and others. So everyone is different, right? And I've come to learn that. I was raised with a with a background of very harsh discipline. So I've learned throughout the years to relax a little bit, to realize that not everybody is a high achiever. Not everybody has these really ambitious goals that I tend to set for myself that sometimes I'm like, why do I do this to myself, right? So learning to let go, right? To be a little less rigid, to be more flexible, to respect others, to respect that we're all different. They rehearse over and over how they will respond in social situations, and projects are often incomplete due to overly strict standards. So let's talk about OCPD versus OCD. So obsessive compulsive disorder is not, it is not obsessive compulsive personality disorder. OCD is characterized by obsessive thoughts and repetition or adherence to rituals. So having to, let's say before I start recording, I have to like spin around in a circle 5 times and say, yes, 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 clap, clap, clap 5 times. Otherwise, in my head, um, I will not record a good video. They have this doomsday feeling of, if I do not do this ritual, something really bad will happen. OCPD is an unhealthy focus on perfectionism. And they often do feel genuine affection for friends and family, yet leisure activities and friendships are dropped in favor of excessive devotion to work and productivity. Guidelines for nursing care: nurses should guard against power struggles with these patients as their need for control is very high. So don't bring your ego into it. Don't bring that you have to be in control because they want to be in control and you guys are just going to clash. Patients with this disorder have difficulty dealing with unexpected changes. Provide structure, yet allow patients extra time to complete habitual behavior, and assist patients to identify ineffective coping and to develop effective coping techniques, and help them understand how being so rigid is affecting their relationships negatively. Treatment for these individuals: they are often aware of their own suffering and they will seek treatment. They may also seek treatment for anxiety or depression. The treatment course is often long and complicated. Group therapy and behavioral therapy can be helpful. And clomipramine, a TCA, may help reduce obsessions, anxiety, and depression associated with this disorder, and SSRIs may also be helpful. But remember that tricyclic antidepressants, they're highly lethal. They're not first course of treatment for, let's say, depression or anxiety or even OCD because of so many side effects that TCAs have. So this is what a textbook was using that I teach for my class, but take it with a grain of salt. Usually psychiatrists will start with the SSRIs. And good job, you made it all the way through. Nursing students be like almost done studying. That is what nursing school feels like. You feel like you could study all your life and you're still not prepared enough for exams. So thank you so much for watching. Make sure that you hit the like button, make sure that you subscribe, and make sure you turn on that notification bell. Share with your friends, please. Share with your friends. I need watch hours.